Hey Jen,
Hey, happy Thursday.
how are you today?
Um, Good. I started the day really early and I'm proud of myself for that.
What
Woke up.
did you do this morning?
Well, I made a decision that on Thursdays I'm gonna start Mondays and Thursdays. I'm gonna start working out early in the morning because we've been so busy in the office that I couldn't fit that in my day anymore. So I'm gonna stop making excuses and I'm gonna get up early in the morning to go to the gym and work out, and I did that today. So
What time did you wake up?
4:15.
Woo! 4:15. See,
Yeah.
I had to ask that because I was still sleeping.
Yep.
That's good. I'm proud of you.
Thank you.
All right. So let's go ahead and jump into the questions. These questions are questions that we get all the time. So we thought that we'd address them today. And a lot of them are chiropractic related, but I'm going to be sharing a story about why we take x-rays that you are definitely going to want to listen to. It is a crazy story about something that happened to me when I was in Singapore. So stay tuned for that. But what's the first question that we have for today?
All right. So the first question that we have today is a question that a lot of the patients we see who've either been to another chiropractor before or have never seen a chiropractor before and have watched too many YouTube videos about chiropractic. And their question is, why can I not crack my own neck? And then usually after asking that question, they would go into like this and see how I can do that. Why can I not just do that to myself?
Yeah, I mean, I joke about this, but people can absolutely crack their own neck, and it just creates exceptional job security for myself because it's always going to end up causing problems later on. And so I want you guys to think of it like this. First of all, there's a major difference between cracking your neck and getting adjusted. And so anybody can make a cracking sound. Like if you just twist your neck or you twist your body, you're going to create cracking sounds, but it doesn't mean that a correction was made or that your subluxation was fixed. All that means was that you stretched your joints out in a way where gas was released from the joint, and that release of gas is the sound that you're hearing. Whether you were on the right segment, in the right line of drive, in the right direction, with the right amount of force to actually create a correction, that has nothing to do with the noise that you're hearing. And so there's a few things that I want you guys to understand. When you crack your own neck, basically what the way most people do it is they don't use their hands and they just do like that and kind of like force it. And think about it, there's nothing specific about that kind of a move. You are just generally overstretching the joints. And chances are you're not going to be coming anywhere near correcting the ones that you want to correct. So think about it. If you have a chain and there's a bunch of these links on this chain, there's 7 links to this chain, and the third and the fourth one are stuck, and you have both ends. Let me make sure I'm on screen here. You have both ends, and you start going like this to it, every one of those links are going to move except for the one that you actually want to unlock because the other ones are already moving. Does that make sense?
That,
Okay.
that does make sense.
Okay. Good. Thank you.
That's a good
So,
analogy, actually.
so you're moving the ones that are already moving. So you're going to create more stress on those and cause those to break down faster while allowing that center one to get stuck even more and maybe get even more rusted. So, specificity of the adjustment is incredibly important. The other thing that we're looking at, number two, is also when it comes to the neck, it's knowing which one you want to be moving. Let's say you do are like, oh, it's painful here. Let me try to adjust this. Let me watch a video or watch how Dr. Matt does it and try to adjust like that. And what happens is if you end up trying to do it, but you're not on the right segment, you're just going to create more and more problems. And so this is how every single patient that comes in that does this to themselves, this is how it goes. They they're like, oh, well, I do it to myself like this and it feels better. And I said, yeah, for how long? And they're like, oh, well, I don't know, for a little while. And then I'm like, and then what? You're like, then I got to do it again. And so I was like, let me guess. You started off doing it once in a while, then you started doing it daily. Now you're doing it multiple times a day. And now it seems like your neck is always stiff and you're always having to do it. And they're like, yes, that's actually exactly what's going on. And I said, well, if you were actually correcting it, then wouldn't you need to do it less rather than do it more? Like when we see patients, our goal is to not see them 3 times a week for the rest of their lives. It's to get the problem corrected as early as we can, as quickly as we can, and then see them as little as possible while still maintaining the maximum results. And the frequency should decrease over that period of time, not increase. So then the next question is, well, if it's bad for me, then how could it feel so good? And the analogy that I use is it's like scratching a scab. It's like, let's say you cut yourself and that cut starts scabbing over. And when it starts to scab, it gets itchy. So what do you do when something's itchy? You scratch it and it feels better temporarily. Then it comes back even itchier. You scratch it again, feels good temporarily. Then you scratch it again, and eventually you peel this scab off, it starts bleeding again, and now you have much bigger problems. So just because something feels good doesn't mean that it's good for you. And when you're trying to manipulate yourself and you're cracking yourself, essentially what you're doing is you're picking that scab that's in your spine, and which is why it just keeps getting worse and worse over time. So even though it feels good, doesn't necessarily mean that it's good for you.
Yeah, those are actually really good analogies because we've had a few patients who've before coming in asked that same question too, and it just makes me cringe when they do it to themselves in front of me. I'm like, do not do that. You're hurting yourself even more. So that's really good. And we have a few patients who actually said after seeing us, they stopped doing it anymore because now they understand why it's bad.
Well, and if things are getting corrected, you shouldn't
Mhm.
feel the need to, because
Yeah,
when things are aligned properly, when there's not that pressure or stress there, you don't have that need to constantly manipulate
yeah,
yourself.
that makes sense. All right. Let us move on to the next questions. Next one. Okay, so you talked about earlier about this story about this guy that you were in a consultation with about needing X-rays, and his question was, "Why do I need to get X-rays?" And actually, why do we need to take X-rays with our patients?
Okay, so we want to take x-rays for a few reasons. Number one, safety. We have to be able to see what we're working on and to know that it's safe. We want to make sure that there's no fractures, no contraindications, no red flags that could cause more problems if we start working on that area. So that's number one. Number two is specificity. Is the more criteria that we have that reinforces what we need to do, the better the results are going to be. So for example, when we do a palpation and then we do muscle testing and then we check range of motion and then we do other neurological tests and we check your bilateral weight and we look at your movement, and then we can correlate all of that with what we're finding on the x-ray. It allows us to become much more specific with our approach of adjusting, which allows for much better results than providing more generic or general care. And so I've always taken x-rays, and they've always been an important part of our analysis criteria. And I was practicing in Singapore a few years ago, and I had a patient that came in and he was really adamant about not getting x-rays. He said, listen, I've been to another chiropractor for the last year. I don't know if they took x-rays, but I haven't seen them in a while. And I really don't want to get it again. It's too much of a hassle. I just want to stay and get adjusted. And I said, listen, I'll make a long story short. I was very nice about it, but I was very direct. And the long story short is I would love to take care of you, but I am not trusting my license on another chiropractor when I need to see what's going on. And so if you really don't want to get x-rays, then I will fully support your decision to stay with your old chiropractor. But if you want to be a patient with me, I apologize, but I'm going to have to require x-rays. So very reluctantly, he went and got x-rays, and the x-rays were sent back to me. And I was horrified by what I saw. He had a fracture in the top part of his neck. This is your occiput. This is the base of your skull. Then you have your C1 vertebrae, which is right here. And then you have your C2 vertebrae, which is the second one. And if I peel this back, your C2 has this bone that sticks out. And that's called the dens. And then the atlas, your C1, goes around that, just like there. And then there's a ligament that goes right around here that holds that so it doesn't move and shift. So it doesn't do that, because the spinal cord is what sits right in there. And so, because if that moves, and what's going to happen is it's going to cut off the spinal cord, that can actually kill you. So when I saw his x-ray, his dens was fractured and his head was sitting forward on his neck like this. I mean, that is a major, major issue. If that is not stable, he could die at like any moment. And the wrong move, a minor car accident, an adjustment. I mean, things that could have been really bad. I've only seen it once in my whole career, but once is enough. And so I was telling him, I said, this is really dangerous. What kind of an injury did you have? What accident? You have a fracture up there. He's like, oh, I think when I was younger and I was a kid, I fell on my head. And he went into this story. And I said, listen, I go, it's probably stable by now, but there is a good chance that it's not. And we do not want to risk it. You have to go to a neurosurgeon for a consult to make sure that that's stable, because that might require surgery. And he goes, no, I don't think it's that big of a deal. Look, I can do it myself. And he goes, and I about lost it, because there could have been a very real possibility that he dropped dead in my office by doing that with what we saw there. So very reluctantly, he ended up going to a neurosurgeon, and they said the same thing. It's been there a really long time. It's probably stable by now, but we really need to do some advanced imaging just to make sure, because it could be very dangerous. And he decided not to do it. And I ended up never touching his neck ever, because he never wanted to go through the steps to make sure that it was safe to adjust. But it was that moment that I said, you know what? I cannot compromise. And if I'm going to be adjusting somebody's cervical spine, we have to make sure that we have an x-ray so we can see exactly what's going on and make sure that, number one, it's safe to adjust. And number two, to make sure that we are adjusting the right segments at the right time and the right line of drive. And that comes from creating a comprehensive picture. So I know we're getting a little long in the tooth. So maybe, I know we had a third question about how young is too young to be getting adjusted. Maybe we'll save that one for next week. And we have a couple of other really good questions that patients asked today, actually, that we're going to be adding onto the list. So you're going to want to stay tuned next week for our next installment of Q&A with Dr. Matt and Jen. Thank you so much for tuning in today. If you have any questions, post them below or send us a message. We are always here to help. And Jen, do you have any final words? Or are you good?
I think we're good. We're saving some of the questions for next week, and you guys should stay tuned for that. And everyone have a great weekend.
All right. Take care, everyone. Bye-bye.